तो हेलो गाइस, वेलकम बैक टू न्यू वीडियो ऑफ मेडिकल यूट्यूब चैनल। तो मेरा नाम है आकाश। तो आज हम एक इंपॉर्टेंट टॉपिक कवर करने वाले हैं, दैट इज इंक्लूजन बॉडीज़। इंक्लूजन बॉडीज़ वन ऑफ द एमसीक्यू क्वेश्चन भी है और 3 मार्क्स का क्वेश्चन भी है। तो मैं एमसीक्यू क्वेश्चन का कवर करने वाला हूँ। तो पहले आता है व्हाट इज इंक्लूजन बॉडीज़। इंक्लूजन बॉडीज़ आर नथिंग बट द इंट्रासेलुलर, इंट्रासाइटोप्लाज्मिक और इंट्रान्यूक्लियर डेपोजिशन ऑफ substances or degenerating substances or viral particles which are stainable. These are known as inclusion bodies. Inclusion bodies are divided into intracytoplasmic and intranuclear. Intracytoplasmic depositions examples are Henderson-Peterson bodies, that is molluscum seen in molluscum contagiosum, Negri body seen in rabies, gonorrhea body seen in smallpox, Paston body seen in smallpox, and Bollinger bodies and Borrell bodies seen in foulpox. Next is intranuclear. Intranuclear, that is acidophilic and basophilic. In acidophilic there are two types, that is Cowdry type A and Cowdry type B. In basophilic also there is Cowdry type B. In acidophilic Cowdry type A we will see varicella zoster virus, herpes simplex virus and yellow fever virus. In Cowdry type B and the acidophilic are poliovirus. And in basophilic Cowdry type B we will see adenovirus and cytomegalovirus. It is a very clear representation. You better take a screenshot of it. Acidophilic means it will stain pink in color, and basophilic it will stain blue in color by eosin and hematoxylin stain. And these are all viral inclusion bodies, means deposition of viral particles or some substances. Next, plasma bodies. Plasma bodies are nothing but the concentric lamellated structure because of a deposition of calcium salts in it. It is seen in calcification like metastatic and dystrophic calcification and various type of other neoplastic conditions. Here are some examples of neoplastic conditions, that is papillary thyroid carcinoma, papillary renal cell carcinoma, ovarian papillary serous cyst adenocarcinoma, endometrial adenocarcinoma, meningiomas, mesothelioma, somatostatinoma and prolactinoma. The most important one among these are papillary thyroid carcinoma and ovary papillary serous cyst adenoma and meningioma. Papillary thyroid carcinoma, serous cyst adenoma and meningioma are examples of plasma bodies in tumors. Next coming to the inclusion bodies in skin conditions. Inclusion bodies in skin. Next I will zoom. First of all we will see that is asteroid bodies. Asteroid bodies seen in sporotrichosis by Sporotrichs shinki. It is in microbiology, and you can see asteroid bodies. They are star shaped deposition. Next is Cowdry type A, that is seen in herpes simplex. Donovan body seen in granuloma inguinale. Duchar body seen in multiple myeloma, primary cutaneous marginal zone lymphoma. Pustulo-ovoid bodies in granulocyte cell tumor. Medlar bodies in chromoblastomycosis. Michaelis-Goutman bodies in melanchoplakia. Rocha-Lima bodies in verrugosa, that is not important. Next is Russell body seen in multiple myeloma, and Verrocchio body seen in schwannoma, and Virchow body seen in leprosy. Here are some of the important inclusion bodies present in skin conditions, and you can take screenshot of it. And it is like MCQ. They will ask like which type of body is seen in which disease condition, and they will give 4 options, and you have to tick that. Okay. Next, here are some RBC structures and in which type they are seen. First we will talk about the target cell. Target cell means it will look like a target, a bow and arrow. We will hit the arrow to the target. It looks like target cell. It is seen in thalassemia, hemoglobinopathies, and post-splenectomy liver disease and artifact. Next are the bite cell. Bite cell are nothing but the RBCs and look like some of the look like the macrophages biten the RBC. It is seen in G6PD deficiency, glucose 6-phosphate dehydrogenase deficiency, unstable hemoglobin disorders, and oxidative drugs. Next, coming to the sickle cell. Sickle cell is the most common. You all know that it is seen in sickle cell anemia and beta thalassemia. Teardrop cell. The RBC will be structured like a teardrop. It is seen in myelofibrosis and underlying marrow infiltrate. Next, coming to the spur cell. Spur cell is also known as acanthocyte. Whenever you hear the word acanth amoeba, you also heard in acanth amoeba. It is seen in microbiology like free living amoeba. Acanth means spiky projection, like horn spike types. It is seen in beta lipoproteinemia, liver diseases, post splenectomy, and McLeod Burglut phenotype. Next is Burr cells. Burr cell is nothing but echinocyte. It is seen in uremia, artifact, and liver diseases. Hemoglobin C crystals seen in hemoglobin C disease and hemoglobin SC disease. Rolex formation is seen in chronic liver disease, malignant lymphoma, multiple myeloma, and chronic inflammatory diseases. Next is RBC agglutination. Agglutination is nothing but clumping up of the RBC. It is seen in cold autoimmune hemolytic anemia, paroxysmal cold hemoglobinuria, IgM associated lymphoma, and multiple myeloma. These are the different types of RBC structure. I have one more picture. This is a more beautiful presentation, and you can see change in the size of RBC is known as anisocytosis, and change in shape is known as poikilocytosis or pyokilocytosis, that pronunciation. Next, DIC is disseminated intravascular coagulation, G6PD is glucose isovernate, HUS is hemolytic uremic syndrome. So I have covered almost all among this. I left is macrocyte. Macrocyte is seen in liver diseases, alcoholic ovalin megaloblastic anemia. Macrocyte is megaloblastic anemia. Microcyte is microcytic anemia. That is a microcytic anemia examples are sideroblastic anemia, iron deficiency anemia, thalassemia, and anemia due to chronic disease. Okay, next is pencil cells. Pencil cells are seen in iron deficiency anemia. Next, fragment cells or fragments of the RBC seen in disseminated intravascular coagulation, microangiopathy, hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, burns, and cardiac walls. Next is elliptocyte. Elliptocyte means the RBC structure will be in the shape of a ellipse. That is seen in hereditary elliptocytosis. Next is basket cell. Basket cell are seen in oxidative damage, that is by G6PD deficiency and unstable hemoglobinopathy. Next is sickle cell. Microcyte is seen in iron deficiency and hemoglobinopathy. Sideroblastic anemia, iron deficiency anemia, thalassemia, and anemia due to chronic disease. That is microcytic anemia. Okay. Now we will see the various types of picture of the bodies, and I have a very beautiful presentation. Let's go through it. Inclusion bodies is a 3 marks question, so go through it. Now we will do the rapid revision of pathology bodies that are seen. Most of the inclusion bodies are pathological bodies which are seen most commonly, and there are many pictorial representation. We will see only important ones in descriptive. Otherwise, other things just we will know the names. First, we will coming to the asteroid bodies. Asteroid bodies are seen in sporotrichosis and sarcoidosis. These are the star shape inclusions present seen in sporotrichosis and sarcoidosis. Next is Henderson-Peterson bodies that are seen in molluscum contagiosum or molluscum bodies. Next, LCL bodies, it is seen in pseudocosis. Next, Leishmania donovani bodies seen in Kala Azar. Kala Azar, the word itself means black fever. And what is Black Death? Black Death is plague caused by Yersinia pestis. Next, next pathological body is a Negri body. Negri body is the most famous and most asked MCQ question. It is seen in rabies. Rabies, it is a zoonotic disease caused by a rabies virus, and the one you are seeing here, it is an inclusion body, rabies. And once in Viva, sir asked me in the what cell you will see the Negri bodies. This is a pyramidal cell of a cerebellum. You know that after the centripetal spread of the rabies virus goes to the brain, cerebellum and the hippocampus. From there it will spread to the centrifugal spread to the eye, ear, and the skin. Next, gonorrhea bodies. Gonorrhea bodies are seen in vaccinia. Vaccinia is nothing but the smallpox, and mostly they will use these pictures only because these are the most classical pictures. Next is Bollinger and Borrell bodies are seen in fowl pox. Russell bodies are seen in multiple myeloma. Once take a look. Next coming to the Ashoff bodies. Ashoff bodies, you all know, you have read the rheumatic fever or rheumatic heart disease. You will see Ashoff bodies there. Ashoff bodies are nothing but the cluster of Anishkov cells. Anishkov cells are the caterpillar cells. When they are arranged in a cluster, when they are arranged in a cluster, they look like they will form the Ashoff bodies. Okay. Next is Karl Exner bodies seen in granulosa cell tumor. The one which are rounded ones are Karl Exner's bodies. These are seen in granulosa cell tumor. These two are the most important questions also. Next, Lewis bodies. Lewis body are seen in Alzheimer's disease and Parkinsonism. Lewis bodies are nothing but the abnormal deposition of the protein content in the brain, which leads to the dementia. Dementia means the memory loss, and mainly in Alzheimer's disease there will be deposition of A beta protein, that is amyloidosis. Next is in Parkinsonism. Parkinsonism, we know that there is decrease in dopamine production. So we will give dopamine analogs, and or otherwise we will suppress the acetylcholine. Next, caveta bodies are seen in lichen planus. Just know the name. Next, Schiller dual bodies are seen in endodermal sinus tumor. Cerola bodies are seen in bronchial asthma. Hens bodies are seen in G6PD deficiency. This hens body is important. Hens body is seen in G6PD deficiency. You go through it. Next, Hirano bodies are seen in Alzheimer's. Alzheimer's disease, Levy bodies are also seen, and Hirano bodies are also seen. Next, ferruginous bodies are seen in asbestosis. In asbestosis, we will see asbestosis rods like they will be like dumbbell shape type. Asbestosis bodies are seen in they will be deposited in the lung. This is a lung specimen. Next is Verroca bodies. Verroca bodies are seen in schwannoma. Schwannoma is, there will be, we will see Verroca bodies. In Verroca bodies, there will be like Antony A pattern and Antony B pattern. There will be cluster fibers of the nerve bundle fibers, and Schwann cells, carcinoma of the Schwann cells. There will be types like Antony A pattern. There is a compact cellularity in Antony A pattern, and in Antony B pattern, we will see loose cellular areas. The Verroca bodies are formed by areas of Antony A pattern which show palisade layers. Let me show. This is a nerve bundle fiber, and they will be arranged in a cluster like palisade arrangement, and this one will be a Verroca body. These are Antony A pattern. Antony A pattern means these are the compact cellularity, not the loose cellularity. Loose cellularity will be in the surrounding. The surrounding, that will be Antony B pattern. Okay. And Verroca body is one of the most 3 marks asked question. Next, Pappenheimer bodies. Pappenheimer bodies are seen in splenectomy, sickle cell disease, and sideroblastic anemia. You can see Pappenheimer bodies. Next important is Howell-Joel body. Howell-Joel body is seen in splenectomy, hemolytic, and pernicious anemia. Next pathological body is Cowdroy type A bodies. You know that in acidophilic and basophilic they have Cowdroy type A and Cowdroy type B pattern. Cowdroy type A bodies are seen in herpes simplex virus. We already know the examples, but now we are seeing the specimen. Next is Cowdroy type B, that is seen in adenovirus. These are the pictograph of those inclusions. Next, Cowdroy type B body in cytomegalovirus. It is in like almost like owl eye type. Next, hematoxylin bodies. It is seen in systemic lupus erythematosus. SLE, systemic lupus erythematosus. Next, Nissal's granules or Nissal bodies. You know, almost it is like a neuron inside in nerve, cyton, axon, and the dendrites. In cyton, we will see Nissal's granules or Nissal's bodies surrounding the nucleus. Cytoplasmic inclusion in neuron, Nissal's bodies. Next is Donovan bodies. Donovan bodies are seen in granuloma inguinal. This is a pictograph of it. Rayleigh bodies are seen in Hurler's syndrome, and Mallory bodies. Mallory bodies are most common, that is seen in alcoholic cirrhosis. Cirrhosis, before that there are stages like first there will be fatty chains, then steatohepatitis, then it leads to cirrhosis. Next, Councilman bodies are seen in acute viral hepatitis, and Torre bodies are seen in yellow fever. Michaelis-Goutman bodies are seen in melocoplakia, and Bunina bodies are seen in ALS. Just know the names. Next, sclerotic bodies. Sclerotic bodies are seen in chromoblastomycosis. This we will read in microbiology. And it is also MCQ question which is asked previous year only, that is sclerotic bodies are seen in chromoblastomycosis, previous year question paper, you can check it. Next, Rushton bodies are seen in odontogenic cyst. Pacema bodies, we have just now saw that Pacema bodies are concentric lamellated structure because of calcium salt deposition, seen most commonly in papillary thyroid carcinoma and meningioma. I have shown 3 marks question, that is Pacema bodies. Next is Gamma Gandhi bodies. Gamma Gandhi bodies are seen in CVC spleen, that is chronic venous congestion of the spleen, that is caused due to the portal hypertension. Gamma Gandhi bodies, take a look. The arrow mark shows the Gamma Gandhi bodies. And this is the Pacema bodies. The Pacema bodies is not so much clear, but you can see better picture other than this. Next, Arrow Perkins bodies seen in androgenic alopecia. Alopecia means hair loss. Next, banana bodies are seen in Fabry's disease and ochronosis. Ochronosis is seen in alkaptonuria. Alkaptonuria means deposition of alkaptone bodies in the ear, that is blue black in color, that is seen in ochronosis, abnormal deposition of alkaptone bodies. Next is caterpillar bodies is seen in Porphyria. You can see it looks like a caterpillar only. Next is comma shaped bodies are seen in benign cephalic histocytosis. Next, Camino bodies are seen in Spitz nevus. Here are those. These are Camino bodies are seen in Spitz nevus, and Ducher bodies are seen in multiple myeloma and B cell lymphoma. The arrow marks show the Ducher bodies which are seen in B cell multiple myeloma and B cell lymphoma. Ducher bodies. Next, Lafora bodies are seen in Lafora disease, and Dole bodies are seen in May-Heglin anomaly, MHA. As this is a revision video, I am just telling the names. Armani-Epstein bodies are seen in diabetic ketoacidosis, and Marinsko bodies are seen in Parkinson's disease. Next, pustulo-ovoid bodies are seen in pustulo-ovoid bodies of Millian. Pustulo-ovoid bodies are seen in granulosa cell tumor. This is also important question. Pustulo-ovoid bodies are seen in granulosa cell tumor. Papillary mesenchymal bodies are seen in trichoblastoma and trichoepithelioma. Next is PIC bodies are seen in frontotemporal dementia, and Simchovis bodies, pronunciation you go through it, that is a granulovacuolar degeneration. Next is Toto bodies are seen in peripheral giant cell granuloma, and Wegener-Meissner's bodies are seen in neurofibroma and schwannoma. In schwannoma we will see Verrocchio bodies, and Wegener-Meissner bodies are also seen in schwannoma. Next is Weibel Palade bodies are seen in von Willebrand disease. Zell-Ballen bodies are seen in pheochromocytoma. Next, Fessas bodies are seen in thalassemia, and Gamma-Favre bodies are seen in lymphogranuloma venerum. Curvilinear bodies are seen in HCQ-induced renal lipidosis, and Davidson bodies are seen in nuclear appendage of WBC. Go through them. Next, I have said about the Ashoff bodies. Ashoff bodies are formed by the cluster of Anishko cells. Anishko cells are nothing but the caterpillar cells which are seen in rheumatic heart disease. When this wait, let me show. Here you can see a caterpillar arrangement. When this cross section will be taken like this, it will be look like this like. Okay. This will be Anishko cell, the cluster of these Anishko cells which leads to the Ashoff bodies. Next is Cabot rings. Cabot rings are seen in trichoepithelioma and trichoblastoma. Okay, we have reached the end of this video. Once we will do revision, like you can go through them. Asteroid bodies in sporotrichosis and sarcoidosis. Leishmania dono bodies are seen in Kala-Azar. Henderson-Peterson bodies are seen in Molluscum contagiosum. Negri bodies in rabies, and Gonorrhea bodies in smallpox. Bollinger and Borrell bodies in foulpox. Russell bodies in multiple myeloma. Ashoff bodies in rheumatic heart disease. Karl Exner bodies in granulosa cell tumor. Levy bodies are seen in Alzheimer's disease and Parkinsonism. Hence bodies are seen in G6PD deficiency. Hirano bodies in Alzheimer's. Next, Verrocchio bodies are seen in schwannoma, most important Verrocchio bodies. Next is Pappenheimer bodies are seen in splenectomy, sickle cell anemia, and sideroblastic anemia. Pappenheimer bodies are seen in splenectomy, sickle cell disease, and sideroblastic anemia. SSS, Pappenheimer bodies. Howell-Joel bodies are seen in splenectomy, hemolytic, and pernicious anemia. Howell-Joel bodies. Cowdray type A and Cowdray type B bodies are seen in, it is from herpes simplex virus, and this is from adenovirus. And Cowdray type B bodies are seen in cytomegalovirus. Hematoxylin bodies are seen in systemic lupus erythematosus. Nissal's bodies are cytoplasmic inclusion in the neuron. Donan bodies are seen in granuloma inguinal. and Mallory bodies are seen in alcoholic cirrhosis. Sclerotic bodies are seen in chromoblastomycosis. Gamma antibodies are seen in CVC spleen, and Pasama bodies are, this is a calcified deposits in meningioma, papillary thyroid carcinoma, and various other examples. Next, banana bodies from Fabry's disease and ochronosis, caterpillar bodies from porphyria, Duchar bodies are seen in multiple myeloma and B-cell lymphoma, Dole bodies are seen in May-Heglin anomaly. Armani-Epstein bodies are seen in diabetic ketoacidosis. Pustulo-ovoid bodies are seen in granulosa cell tumor. Pick bodies are seen in frontotemporal dementia. And Wegener and Messner bodies are seen in neurofibroma and schwannoma. Zell-Bellin bodies are seen in pheochromocytoma. Davidson bodies are nuclear appendage of WBC, and Anischko cells are seen in rheumatic heart disease. Through this, we have finished all the inclusion bodies almost like I have covered. It is for MCQ questions. See you in the next video. Until then, Jai Hind, Jai Bharat.